Welcome to the Heart Rate Variability Podcast. In this podcast, we discuss the exciting science behind HRV and how you can apply it to your own health and the work that you do. Just a note, this podcast does not replace medical advice, and if you're going to apply this to your own life or others, please consult with a medical provider. Thank you and enjoy the show.
Hello, everybody, and welcome to the fifth episode in our Heart Rate Variability podcast series. Jeff Summers here, joined by my colleague and co-founder of Optimal HRV, Matt Bennett.
Hey, Jeff.
Matt, how are you?
Doing good today. Excited to talk about groups.
Yeah. We are going to focus today's episode on HRV and how it pertains to the health and wellness of groups and how we can sort of relate population norms, not only to individuals, but individuals within groups, especially from an organizational standpoint. So we talked a lot last week about states, traits, how HRV helps to sort of monitor that. We brought in the whole concept of measuring yourself against the population norm and what that means. But there's a whole other opportunity here that most people really haven't focused on in the HRV world of bringing this concept to a group level. So it's something that you dive into in the book, Matt, and I think it's definitely worth dedicating an episode to.
Awesome. I'm excited. So I'm going to just share my screen right off the bat. Again, for those just listening, I will do my best to verbalize this as well. So basically, if you're just listening to us, we've got scores here from the latest, the previous, again, last week, last month, and all time. So we got those averages there as well. You would also see, if you're looking at this, a list of participants with positive HRV trend and participants with a negative one. So we got a list of names and their latest readings in a green or a red, depending on if they're doing well or if they're not doing so well. So Jeff, this is when I came to you to see what your thoughts were about doing this project. This screen right here is what I really saw that was missing in all the HRV apps that I was trying to figure out how to bring into organizations I worked with. So where I saw the real benefit to this, again, is with my background as a therapist, we see people once a week, once every other week. That's kind of the model that we're in. The typical is once a week, even though sometimes it might be twice a week if there's severity there. But, one of the things that I really struggle with is how are people doing when I'm not sitting across from them? If I just get 1 hour out of the entire week, and this person might be at risk for relapse, this person might be at risk for suicide or self-harm or violence. How do I know when to reach out and help them? And so this was one of the real emphases behind us creating this app. Again, wasn't out there when we needed it. And one of the things that I really wanted to take a look at was, how do we know when somebody's struggling? And so, as we talk about a lot in the book, is usually a one-day negative trend, depending on the person, probably not something to get too concerned about. Again, we always say for the helper, the person and the clinician, the person. This just gives you additional data. So if you're really worried about somebody and you see a 40% drop from one day to the next, you might want to reach out. But usually what we see in the literature is about 2 to 3 days of that significant drop is really where we need to start to worry. So this, if you think about yourself and you put yourself in the position of a clinician, this really gives you, what we call in our field, Jeff, kind of your caseload. You can log in every day as part of your kind of routine, whether that's in the morning or at lunch, and see how your folks are doing that day. Again, most folks, most days, you probably don't have a lot to focus on. But if you're looking at us on YouTube here, you'll see John here is really struggling today. So you can click in and look more in, and this is all kind of part of our app here. You can kind of see his last several readings. So you can then go into more depth around what John's struggling with. get more information and really determine, okay, do I need to reach out to John today? You also obviously see the people that are doing good as well. So this, from a clinical point of view, really gives you a check-in every other time. Now, the other thing that this really does as well, and we talked about this last time too, is that it helps us track our outcomes. It helps us really track how well this person's doing with the intervention, with the treatment that we are providing. So again, we should be able to track growth over time with this. So this screenshot right here, Jeff, is to me, what I'm really excited about with what we've done with Optimal HRV is now, in a way that complies with HIPAA and confidentiality standards, you get a snapshot of your caseload, which then quickly allows you to drill down around specific clients from that point. So again, this just gives you a way to track it. If that group maybe is in residential together, I think we'll talk more about this from the management perspective. There might be some benefit in tracking groups over time. Usually there's people graduating from your caseload, coming into your caseload. So some of the group averages might not be as important from the clinical perspective. But again, if you've got a group of people, let's say maybe you've got this on students in a classroom together, it could help give you some information of how the class is doing today. With that, I know, again, we'll talk a little bit more about that as we go forward, but to me, this is where the real, hopefully, life-saving part of this is that if we see somebody having a 3-day crash, hey, let me make a phone call. And everybody that has done, counseling, clinical work in the helping professions knows that relational support is so critical and important, especially if somebody's really struggling.
Yeah, I mean, and that's part of what got me so excited about, what you proposed was obviously the ability to save lives. And I think the interesting thing too, and you can talk a lot more about this than I can, not being in your world, but you sort of have this idea of preventative care, right? Having this dashboard that shows you when the decline in HRV is trending, and you need to be proactive about, what you do. But then to me, there's also the sort of day of, right? Yeah. And so you've got the unplanned interventions that can come into play as a result of having your group tracked on Optimal HRV or any HRV tool. But then day of, you've got this care plan, this treatment plan, apologies if I'm not using the proper,
actually, good job.
Term. But so historically, you've had no way to vary that. And often I'm sure you've come into situations where it didn't work the way you had envisioned going into it. And you really had no way to know that they just weren't in a place where they were going to be productive with the session you had planned for them. I would assume that this is a tool that would help you sort of, call an audible for those football fans for the, which I know Matt is not one of, but for that treatment plan for the day based on how they're doing. If they're not ready for what you're proposing, you need to be able to pivot quickly. Otherwise, you're going to have a disaster on your hands.
Absolutely. And we, there's a lot of research, and touch on it now. Maybe we can, in a future episode, go more into depth of it. But you're absolutely right, Jeff. There is a really exciting piece of this that connects HRV to social health. If you hear me talk about it, I'm usually saying it's a measure of mental, medical, social, and cognitive health. To me, the other thing that got me really excited about this when I was doing the podcast, on my other podcast, when I first got introduced to this, is we can predict the level that somebody is able to socially engage with us based on HRV score. And so for a clinician, if you come in and I see your HRV score is below the norm, then I'm going to maybe do some mindfulness stuff. I'm not going to push. Maybe we were set to do some trauma therapy where we might do some really difficult work. If your HRV has crashed, I'm not going to start off there. At least I'm going to do maybe some relational support stuff. Again, mindfulness stuff. If they're telling me that they're depressed, I might, this sounds weird for a lot of therapists, but hey, maybe do some jumping jacks, get some sympathetic arousal to give some energy going. So again, and this talks a little bit about more pre-session readings can give you a really good job. Now the other thing that you're talking about, I'm going to share the screen here again for those that are viewing us, is let's again, we'll go into John here. And so for example, we see John, and we just have a few readings in here for an example, but you know, his all time's 37. I know his morning reading today was 24. His previous reading, which again, I can get more information if I drill in, was also 24. So he's struggling a little bit this week, not significantly, but there's a struggle going on this week. He's sort of had a bad month if you look at that as a 26 compared to the 37. And the last few days have been well below his average as well. So now I know, okay, I got to have kind of an HRV informed discussion with John. What's been going on? What can we do from a self-care perspective to get this back on? Is he feeling more anxious or depressed? So maybe if I'm starting to look at these numbers over an extended period of time, maybe now is when a medication conversation to see a psychiatrist to just do a different level of examination, especially if we're seeing a major depressive episode that this might do. Again, we're going to take a lot of other clinical information before making those referrals, but this is somebody who's struggling right now. And so that would definitely inform, you know, my conversation with John is I'm probably not going to dig deeper at new stuff. I'm going to really probably brainstorm how do we get his recovery back into a good place. So you're absolutely right. We get some really nice information here to really develop care as well. You know, the other thing I'm really interested in, and this is a little trickier because, you know, as a therapist, I might get once a week, but I really see this, Jeff, as, you know, when you look at like medicine, like this is a vital to show, okay, here's where the treatment happened, tracking that over time. So, you know, you can even think about a medical doctor pulls this up and looks at like the HRV scores since the last time they've seen the patient. Maybe they started medication 3 weeks ago, gives you a lot better information than just a one-off blood pressure, weight. They still measure my height, even though they have to take the thing out of the, like poor person trying to measure me.
Yeah,
like,
you got to hold it up yourself.
Let me help you with that. Let's just say 6'7", even though I've always, I think, been 6'6". I just like rounding up. But yeah. So, you know, it gives you a lot of great information. Again, it is one more data point that can inform your decision making as again, if you're in the healing and helping professions.
No, that's great. And I think we did a good job of sort of covering the value for the group if you are responsible for a certain set of clients or patients or, you know, employees or whatever it is. But there is sort of that next level of value when you think of a group construct to an entire organization, right? And so as a clinician, caregiver, manager, fill in the blank, you want to know how all the people that you're responsible for are doing so that you can use that dashboard as a way to reach out, provide, you know, preventative and reactive care interventions, meetings, whatever world you happen to live in, right?
Yeah.
But what if you're an executive? You know, you're responsible for a lot of people. You don't have the day-to-day interaction with a lot of them, but you're still ultimately responsible for the care they're being given or their experience as an employee or whatever it is. And I mean, you've been an executive at nonprofit organizations before. You've been responsible for staff and clients and everybody that anybody who came through the doors of your facility ultimately rolled up to you. So how do you take it to the next level?
This is where it's really exciting. You know, I'm going to share my screen again, a little bit of a different view this time for folks. And this is the organizational dashboard, as we call it. And again, don't worry if you're watching this, you know, about the titles here. So if you're listening to us, again, we've got latest, previous, last week, last month, all-time averages there. And then we have different groups. So just like we have for the clinician, you have a dashboard of your clients. As an executive, now you have wellness of certain groups. So in this thing, you can see basically these scores, these averages, the last week, last month, all-time averages, is how well are we doing as an organization? Think about that. If you're a manager, a supervisor, when have you ever been able to really quantify that, at least on a regular basis? Again, we might have employee satisfaction, safety surveys.
Yeah,
But
that's
even,
the difference, right?
yeah,
How do you have raw data to support it, as opposed to sending out surveys or relying on people to be honest with
well,
their
even the
wellness?
organizations that buy into the surveys, and I'm not against surveys at all. I actually
No,
would say do them. Are you going to do them more than every 6 months? Because they take a lot of time to do, right? So
yep,
what about, you talk about what can happen in a week in the life of a therapy client. There's a lot that can happen within an organization. So the really cool thing about this is now, as an executive, again, as part of my morning routine, if we got it, and we can kind of talk about some of the challenges that may exist here, and I want to just put those up front. But let's just, for the hypothetical here, Jeff, say, everybody's taking morning readings on a regular basis within this organization. So, for example, I see my case managers have gone down a little bit in average. So, the other thing you can do is I can drill down a little bit. I'm just going to use a different group here because there's more people in it. And again, it's the same screen we basically saw for the clients. Now I can see where individual staff are trending in a positive or negative direction as well. So all of a sudden I can see how the group health changes over time too. So it gives you this level of information, whereas for a lot of people, clinicians, maybe the group scores aren't that important. How well is my team doing today? How are they trending this month over time? And this is where you can get some really good information, especially let's say a client, and this happens in our world, brings a gun in and threatens people. Obviously, that could be a borderline, if not a traumatic situation for a lot of folks within the organization. Most organizations would offer a great deal of support to those individuals. How effective is that support getting folks back down to base or back up to baseline? So in other words, something happened that impacted their mental, cognitive, social health, traumatic event, or for most people, at least a highly stressful, borderline traumatic event. How well is the organization supporting that team in their recovery process, which can be tricky because those people still probably have to come to work because you got to keep your program open. How well have they recovered? And what are things that can do to get them back up to baseline? Because as long as they're running below their baseline, Jeff, we know they're not going to be as effective, not going to be as productive at their work. Now, we shouldn't expect them to right off the bat if they thought their life was in danger the day before. But what can we do to support them getting it back? Maybe using our employee assistance program support. How can we track this improvement over time? So now we can start to structure this. And to me, what's a really exciting way is that depending wherever you're at in the organization, but let's say you're on the executive team of an organization, I log in and I see the health of my executive team, but also other teams around the organization. How are my groups doing against the organizational average? How's the accounting department doing against the organizational average? How are the case managers? How's that department that had that traumatic experience doing? So we can start to then build on this. And again, just like if I'm working with a client, I do an intervention, I want to see HRV improve over time going forward. It shows that my intervention is having a positive effect. Same thing for managers, especially in high stress occupations. And if we're honest, most occupations are fairly high stress nowadays. How do we know that our organizational wellness initiatives are working and that we're getting a return on our investment? So you can really start to measure these things and measure team health in a way that I've never seen before. And that to me is the really exciting thing about this, especially, working with healthcare, education, criminal justice. I mean, those systems are just devastated by burnout. Hopefully we can quantify this and start to change those trends.
Yep. No, and it's That's very cool. And if you relate it to sort of the private world, enterprise world, I mean, there's still a ton of value. You might not be of the same impact, you might not be quote unquote saving lives, but the idea of productivity levels being well known to be higher when folks have a better HRV score, and
Yeah.
burnout happening, turnover. I work in a lot of industries where turnover is a huge issue, and it's incredibly expensive to
Oh,
recruit and hire and train. And you're getting 40, 50. I mean, we've got some clients who have 100% turnover within their organizations, and within a 6-month period of time, they're spending more to replace people than they are actually paying the ones that are there.
yeah.
So having a tool like this to figure out, it's one thing to say we want to change it, and it's another thing to implement programs to change it, but then it's a whole nother level of being able to quantify the impact of that and predict and all of those kinds of things. And so from an organizational standpoint, this is an incredibly powerful metric that I don't think many people have considered. It's been very much an individual focused, often fitness for fitness, which is great. And there's huge value and it's very powerful. But this takes it up multiple levels from a goodness for the whole, if that makes sense.
Oh, absolutely. And again, the nice thing is the elite athletes are leading the way.
Of course.
We'll learn
That's great.
there's a lot of HRV monitors on folks in professional sports right now, whether they're in bubbles or not. And it's basically trying to track COVID more than anything else, which is, if you're looking for a reason, should I do HRV now or later? Well, with COVID, again, a 3-day drop in scores is probably showing you, especially if you can't predict any other reason why it's happening, this person probably really needs to get tested.
Yep.
And
Stay
I know
inside.
testing is still an issue in our great United States of America. But, again, we could track this. I find it interesting, Jeff, is that we make the investment to put LeBron James and, all the, basketball
NFL
players.
athletes.
We were talking about NBA before. They're on heart rate variability monitors. What about those kids going back to school? What about those teachers? What about the healthcare
nurses?
What are their early warning signs? And we're able to do that and do it for pennies a day. And
right.
So this is really timely now too. That if we can get this, and I know money for innovation and other things is limited right now, but if we can be another early warning sign that we may see, and again, everything's so new with COVID that I got to use the word may in front of all of this, but it seems highly likely that 6 months from now, we will have good solid proof that a 2 to 3 day significant drop in HRV scores is predictive of COVID. Now, it also might be predictive of burnout and a lot of other things. That's the tricky thing.
Absolutely.
But go get a test, right?
Yeah. And to your point, if you can't think of anything else in your life that would be causing it, go get a test. Stay inside.
Exactly. It's a potential symptom before a cough or other COVID. Lack of smell, those things.
Especially for folks who are asymptomatic.
Yeah, asymptomatic folks have drops in heart rate variability. So that there's a lot of, because illness is a stress as well as a deadline at work. So again, it's not going to tell you exactly what stress it is, but again, it gives you that kind of early warning sign, which can, again, be life-saving in the time of a pandemic.
That's right. So I think the last concept we sort of teased earlier that we haven't talked about, that we brought up last session, was this whole idea of population norms. Yeah. And we talked last week how they pertain to the individual and how it's important, but there's big standard deviations, and your personal baseline is probably a better metric, but the population norms are good to keep in mind. I think from a group perspective, the population norm becomes much more meaningful.
Yes. Yeah, this is where I think the population norms are incredibly insightful, especially from that management perspective. Again, I'd encourage clinicians not to get too lost in it. I encourage individuals not to get too lost in it. Again, for the math nerds out there, which I wouldn't call myself one, but I know what a standard deviation is. In the population norm, there's big standard deviations. However, here's Jeff, where I think that it really can be powerful is when you start to see your group average. So let's say you have a team, you've got a division, you got a department. How are they doing? And you got to do a little bit of math here, but the next version of the app that should be out in a few weeks, we're in late August now, we'll have this worked in. But you start to look at a group versus the population norm average for that group. So that's where the little bit of math comes in, because you got to know gender, age, to get the average for the team as well. So if the average, for the example I've had up, if the average is, let's say, 38, I'll just throw this back up here really quick for those watching us on YouTube. If you've got let's say their average is population norms 38, this group's a 31. Their last week, down here we're seeing these lower scores. This group is not doing very well. There's something that this group, now you can say, okay, the 31 without the reference of the population norms just gives you the baseline for that group. Now bringing in the average population norms really allows you to say, okay, what is the overall health of this group compared to where they should be at? So it gives you a metrics to say, how are they doing? And then again, if they're a little bit below, like one or two below, one or two above, again, that's where the genetics, all that stuff, still depending on the number of people in the group. I mean, the larger the number, the more they should average out to the population norm. But, those things probably not much to worry about, a point here or there. But boy, when you're getting down, 10 points lower, 20%, 30% lower, you've got a team that's really struggling. You're probably, you probably got higher turnover in that group because you got a lot of people burned out. Probably not getting the level of productivity, of social engagement, which is part of most businesses is important, whether that's with their team or customers. That's going to be going problem solving, emotional regulation, all those things that are so critical to business success, not going to be there. If you're in the helping professions, obviously social engagement, cognitive problem solving, mental, emotional health, all those things are so crucial and crucially documented in the literature to be so big about building the relationship that drives outcomes that, this gives a really good piece of feedback for folks on the health of their team and the health of the organization as well. And again, if you're 20% below the population norms, don't spend a whole lot of time crying about it. What are the interventions that you're going to enact to do? Well, why? That's where a survey might, what are we seeing? What are some things we could do? And really start to try things. And when you try things, unlike a survey that you got to wait 6 months, you should see a gradual improvement in the average organizational HRV score over time. So it gives you that quantitative feedback on how you're doing today, how are your employee wellness, productivity, whatever initiatives you're doing, really having the desired impact that you want them to have. So, this is where I think it can be good. Also, one of the things that I think we often get lost in too is what works for one team might not work for another team. And this is what this also gives you. You might do exercise program for one. It may work great for one team, might not work so well for the other team. Maybe the team A is out of shape and the exercise program really helps them. Team B is just as miserable in their HRV score, but they're fairly athletic folks. So that intervention is not really improving their score over time. So you might want to do a different intervention for those folks as well. It doesn't mean the exercise thing's a bad thing for them, but it's not enough to get them to where you want them to be. So again, this just gives, I've always wanted to know as a supervisor, especially in these high stress arena, how are my folks doing today? How's my teams doing today? How's the organization doing today? And HRV gives me the answer to that question. Again, there's still a lot of other information I need to take in and consider. But boy, this gives me some concrete feedback every day. And I'm very clear in the book, at least I hope I'm very, very clear, is I never want an employee to be reprimanded, punished, whatever for a low HRV score. That makes no sense. You lose all kinds of trust. People start putting their monitors on their kids and their spouses and their dogs.
Exactly.
That's
That's not the point. The point is
not
to
the
help.
point.
This is not a
However,
punitive thing.
and people may argue with me about this, I'm fine, using this as an outcome for a manager, as one of their things that they get evaluated on. How is the health and wellness of the team? And I say that because we know mental, emotional, social, even medical health, when you think about from this perspective, because that's, time off, that's time not at the job. If you're cold, you're not as productive. This is all going to determine the success of the team and the organization. So yeah, if you see a supervisor who's got lower scores, gives you a piece of information. I would imagine if the literature all plays out, that person's team probably in the medium to long term is probably getting not as good results, probably having more turnover. And so, it can help you find weaknesses, and maybe, with a good organization, they could say this leader's struggling with their teams. What training can we give that manager to help them succeed? I don't think you should fire somebody right away because, most people have heard of HRV before, but what training can we do to manage this? What interventions can we use with that manager as well? So again, hopefully points out some of those areas for improvement with this. So yeah, I mean, this can really be, and this, I put my MBA hat on a little bit here so the nonprofit people can forgive me, but what a competitive advantage, to know the wellness of your team, to know the wellness of your workforce. One, it's going to save you money. And so whatever you're doing, it's good to have more money. And again, whether you're trying to provide life-saving medical care, suicide prevention, or making widgets, a healthy, engaged workforce is going to produce better outcomes. So this is, to me, the really exciting thing about this from that organizational perspective.
Yeah. I mean, I think it definitely, we've come a long way since our first episode, from just contextually hopefully helping people understand why this biometric is so important. It starts with fitness and sleep, and we were talking about the impact of my family life has on my HRV to start this, and now we're talking about how organizations can increase productivity and provide better outcomes and save lives, right? And so
the cool thing about this, you bring up the family again. I've shared my passion of hoping to really get this integrated in the foster care system, but instead of a group, we call it the family system, right? So
that's right.
Exactly. This is, where's the family score at today? And it gives, again.
Is that why my 3-year-old was throwing a tantrum today? Very possibly. Could it have been predicted? Is there anything we could have done to change it? You never know.
I have yet to see any biometric predict a 3-year-old's behavior, but possibly. That's right.
It might be closer. It might help. Maybe I'm just grasping for straws. Who knows? So what do you want to? So another great episode. What do you want to focus on next week, Matt?
So let's do tags next week. So there's a way to do this, and we'll show some examples. I've been working on some data for us for the next episode, but how certain behaviors influence HRV scores. So one of the functions, most of the apps, including ours, has the ability to tag things. So I should have some good data. I thought I was going to throw it off. I was a little worried because I woke up in the 70s this morning, Jeff. I was like an all-star, and I was going to try to prove how my morning routine boosted by 20%. And I'm like, I'm not going to improve on a 70. Let me just review this for our audience here. My last score, of course I'm on airplane mode, so I won't be able to show you, but I hit 102 this morning, Jeff. So
wow, yeah. That's impressive.
For those at home, that's like a 5-year-old's HRV score. So not mental capacity, but
debatable, but
you lose this with age, and I'm getting age. So I've been working on some data to really show how, like, meditation, my morning routine, really how we can track how that improves HRV score. So I think I got a lot of good data to show, and we'll kind of talk about how that can inform us on a lot of different things and help us track is, hey, what we're doing to improve our health, is it really working? And so yeah, and also tracking the impact of stress on the negative side of it too. So yeah, definitely join us. I think it again gets really practical around how to use HRV as a real tool to improve health and wellness.
Perfect. Well, thanks again, everybody. As always, we appreciate the feedback. Go to optimalhrv.com if you're interested in learning more about what we're doing from an app perspective. Otherwise, we'll see everybody next week with episode 6.
Have a good one, everybody.
Thanks. Take care.
Thank you for joining us for this episode. If you're interested in more information about HRV, please visit us at optimalhrv.com. Also, if you visit optimalhrv.com, you'll be able to sign up for our email list and download our free ebook, Healing with HRV. Thank you for joining us, and we'll see you next episode.